Hi, I'm Dr. Peter Fisher. You're watching the Weight Loss Surgery Channel.
Welcome to Weight Loss Surgery News. I'm your host, Leslie Thompson, and thank you for joining us today. In this week's news, we'll look at a new partnership that's been created to help weight loss surgery patients get the lifestyle education they need. We'll also look at the role baby fat plays in burning off calories and a breakthrough that might help you build up your own supply. And finally, it's that time of year again. Time for Uncle Sam to make his yearly visit, bringing weight loss program funding to all good girls and boys. We'll show you what's in your stocking and how much it could cost you. But first, childhood obesity is a serious problem for everyone. Take the UK, for example. Government statistics say that around 31% of children ages 10 and 11 in England are overweight or obese. And they predict that 90% of today's school children in the UK will be overweight or obese by 2050. The estimated price tag is £50 billion. Dame Deirdre Hutton, the soon-to-be ex-chairman of the UK's Food Standards Agency, wants to nip the trend in the bud and thinks she has an answer: government control of grocery stores. According to Dame Deirdre, grocery stores in the UK should stop selling high-calorie foods, and Her Majesty's government has the right to exert pressure on grocers to make sure they comply. The program she's advocating makes use of so-called traffic light labels, government-suggested labels on the front of food packaging to identify unhealthy food items. These labels contain nutritional information about the food inside, guidance on the maximum recommended daily consumption, and a red alert marking if it exceeds the government's recommended daily levels of salt, sugar, and fats. Not all food sold in the UK carries these labels. Food manufacturers like Nestle and Danone have protested against the label system, arguing that food choices are part of each shopper's private business. Dame Deirdre points out that the UK's big food retailers already use the system, and that those who refuse to go along with it will be pushed hard by the Food Standards Agency to ensure compliance. Government enforcement officers have the power to make spot checks of food manufacturers and retailers to make certain everyone's going along with the plan, handing out stiff fines and legal penalties to nonconformers. While critics of the labeling plan see it as an intolerable intrusion into the private lives of UK citizens, its backers argue that the treatment of obesity costs the UK's national health system a lot of money, taxpayer money, and that the government has the right to take action to control the obesity rate and with it the cost of treating people with obesity. As Congress moves to enact some form of government-controlled health care here in the United States, the issue of government involvement in private behavior, such as buying a bag of potato chips in the name of public health, has come to the forefront of political discussion. As always, we'll keep an eye on the situation as it develops and pass the latest news on to you. Hey, travelers, ever stayed in a five-star hotel? If so, you know how great it can be. But would you believe that having your weight loss surgery done at a five-star hospital can give you better results than you'd get elsewhere? It's true, at least according to a new study from health ratings organization Healthgrades. The survey, which rated the quality of weight loss surgery services in hospitals in 19 states, examined the number of complications reported by patients who had a gastric bypass, gastric banding, or a combination procedure. Hospitals with lower numbers of patient complications were awarded stars. The lower the number of complications, the more stars that hospital got. The results were not surprising. Hospitals with higher patient volume received more stars than those serving lower numbers of patients. And after tallying up the numbers, the study group concluded that patients who had weight loss surgery at the high-volume hospitals were almost 70% less likely to develop post-surgical complications than patients getting the same procedures in lower-volume hospitals. Patients in high-volume hospitals also had shorter hospital stays, more than half a day less in most cases, and a post-operative death rate some 1/3 of the lowest-rated hospitals. The gist of all this is that it's better, statistically speaking, to have your weight loss surgery at a big-volume, big-city hospital than at a small hospital or one in a remote location. Of course, that's a generalization. There are plenty of high-volume hospitals that aren't that great, and plenty of small and local hospitals that offer superb care. Since hospitals vary so much in quality, it's a good idea to research both the doctor and the hospital you're considering for your weight loss surgery before making any decision. When we come back, we'll tell you about a new educational initiative for weight loss surgery patients and tell you what kind of fat can help you fight type 2 diabetes. We'll be right back. After weight loss surgery, it can be hard to get enough vitamins and nutrients in your diet. Bariatric Advantage offers a complete line of nutritional products specifically formulated to meet the unique needs of bariatric patients. Choosing to have weight loss surgery was a big decision and required a big investment. Learn how Bariatric Advantage nutritional supplements can help you get the most from your surgery by keeping your new body healthy and strong. Call us toll-free at 800-898-6888 or visit us online at bariatricadvantage.com.